Mom, I just don't know what's going on with me. Like, I've been getting thirsty, I'm really hungry, and I'm just like peeing a lot. Like, do you know what's going on?
Well, I'm not sure, sweetheart, so that's why I brought you to the doctor to see like what's going on. I wonder if they're gonna do any lab work on you to figure out like to diagnose you. I did notice that you've been losing a lot of weight and that you've been feeling like extremely thirsty.
You can come in.
Hi Marissa, hi Chelsea. Can I just check for your name and date of birth?
Yeah, Marissa Violet, 10/25/98.
Okay, good. So my name is Anna, I'm gonna be your doctor today. What brings you into the clinic?
So I'm just like really like thirsty. There's like changes in my appetite. Like I'm like so thirsty, like I cannot like quench my thirst. Like, do you have water? Like, can I have water later? Like,
I'll see about bringing in some water for you, but for now we're gonna run some blood laboratory tests to see if there's any abnormal values or anything. Is that good with you?
yeah, that's fine.
Okay. Okay, so I'm just gonna send this up to the lab and then we'll see what the results are in a few days or so.
Okay. Perfect. Thank you.
It's good to see you again. I'm just gonna check your name and date of birth.
Okay. 10 Marissa Violet, 10/25/98.
Okay, sounds good. So I've been reviewing your fasting blood glucose and A1C levels, and I would like to talk to you about them.
Okay.
The normal A1C levels is supposed to be below 6.5%. Your A1C levels are 8.7%. The normal fasting blood glucose levels is less than 126 mgdls, and your fasting blood glucose is 210 mgdls. Because both the fasting blood glucose and the A1C levels are elevated, I came to the diagnosis that you have type 1 diabetes. I will prescribe Humalog for you, and I will have the nurse come in to go over further with your diagnosis and how the medication works and how to administer. Okay?
Okay.
Alright, she'll be in shortly.
Okay, perfect.
Hi, my name is Shalini and I'm your nurse today. I'm here to further explain what diabetes is and to answer any further questions that you may have.
Okay. What exactly is type 1 diabetes?
Type 1 diabetes is usually seen in adolescents, usually before the age of 30 years old. The symptoms are relatively abrupt, and the factors that normally influence diabetes is environmental, genetic, and infectious factors. And also, the primary deficit is because the beta cells in your pancreas are being destroyed by the autoimmune process.
My mother actually had type 1 diabetes when she was younger. Does like if that plays a role with genetics, like can my daughter be cured?
There's no cure for diabetes. However, it is very manageable. Your daughter can pursue her normal daily activities. She can manage the symptoms, and there will be an insulin regimen and diet modifications to help.
Okay, I'm on my school's dance team. Like, will I be able to participate in my dance performance coming up? Because it's a huge part of my life.
No, you just have to make sure that you check your blood glucose level regularly and have a 15 grams of carbohydrates before you are active. This will help to prevent any hypoglycemia symptoms. Hypoglycemia is when your blood glucose levels drop below 60 milligrams per deciliter. Symptoms include headache, confusion, weakness, dizziness, and fast heartbeat.
Okay, and what are the signs of when my blood glucose is high?
You're going to feel excessive hunger, thirst, and frequent urination.
And what does Humalog do?
It helps to regulate your blood glucose levels, so it prevents it from going too high or too low. With type 1 diabetes, you have no insulin, so that's why you are taking insulin. It starts 15 minutes right after your injection and lasts about 2 to 4 hours. When you have a meal, you take it right before it.
Okay. Are there any bad side effects along with it?
And the only bad side effect is hypoglycemia. As we mentioned, hypoglycemia is when your blood sugar levels drop below normal. It is good to have a source of sugar with you at all times. Giving injections, you always want to make sure you give it at different locations in the body subcutaneously, or it will cause lipodystrophy. Lipodystrophy is when the subcutaneous fat disappears and causes a dent in your skin. I will have another nurse demonstrate the correct technique for injection of Humalog.
Come in.
Hi, my name is Emily and I'm going to be one of your nurses. I'm here to demonstrate how to administer Humalog and then I'm going to teach back and then you're going to show me how to use it.
Okay.
So can you just verify your name and date of birth for me, please?
Marissa Violet, 10/25, 1998.
Okay, thank you. I'm just gonna wash my hands.
Okay.
So I'm just going to take your vital signs first.
Okay. Do you need me to roll my shirt?
You're okay.
She's alive.
Okay, so your temperature is 97.7, your heart rate is 75, your oxygen is 99, and your blood pressure is 10/70. So your vitals are perfect.
Okay.
So also, before we start your assessment, do you drink any alcohol?
No, I do not.
Okay, so if you ever consume alcohol, just be careful because alcohol can spike your blood sugar. So you may need to supplement your insulin while you drink, so just be mindful of that.
Okay.
And are you taking any other medications right now?
I'm not. I just have a quick question though. Will the injection leave any bruises or scars on me?
No, it should not, but you should also be sure to rotate your injection sites. So since we're doing the injection into your abdomen, just make sure you rotate the site wherever you go. So if you do the injection in your upper abdomen one day, make sure you do it on the other side the next day. Just because if you do not, you could have lipohypertrophy and it could leave scarring there. But if you rotate the sites, that wouldn't be an issue.
Okay.
And you also may have redness or swelling at the injection site. And if the swelling is very large, it could be an allergic reaction, but if not, then you're good.
Okay.
And then if you do have an allergic reaction, you would need to go to the doctor or the emergency room right away. Also ask what a typical diet for you is on the day-to-day.
Okay, so for I'm Italian, so I really my mom makes really good bolognese, so I have penne vodka, pasta all the time. I really love pasta. Last night I ate a loaf of bread by myself. I also work at Dairy Queen, so I get the 50% off. So I sometimes on break I'll have a blizzard, a milkshake. Also when I'm feeling crazy in the morning, so I go to the diner with my friends. I'll just get a Coke with my breakfast. Yeah, so I drink soda and iced coffee from Dunkin'. So yeah, stuff like that.
So I would say for you, just be mindful about how much carbs you're consuming because for every 15 grams of carbohydrates you consume, you need 1 unit of insulin basically. So I'll just be mindful, always check your blood sugar, make sure it's in range. And for soda, that's a lot of sugar just for you to drink. So maybe start drinking diet soda instead because that will not change your blood sugar.
Okay.
Or drink water if you like water. I know some people don't, but maybe add some sugar-free flavoring to it. That might be a good compromise instead of drinking soda all the time because that's really just not that healthy for you. Okay, so now I'm going to teach you how to check your blood glucose levels and how to administer insulin.
Okay.
So first I'm just going to clean my hands. So to check your blood glucose, first you would rub your finger with an alcohol pad just to disinfect the area.
Okay. Does it matter which finger?
No, it doesn't matter what finger.
Okay.
And then you would prick your finger with this. You just prick it like that. And then you clean the first drip of blood away to make sure that's not contaminated either. And then the next drip of blood comes out and then you just test it with the glucose meter like that.
Okay.
And then you just press the button and then it tells you what it is. So your blood glucose is 210. which means that requires 2 units of insulin for you.
Okay, and what's a unit exactly?
So the unit is just how we measure insulin. That's how all insulin is measured, just so everything is regular between all patients. So 2 units isn't that much, it's just a little bit. Like each line on this syringe represents a unit. So 2 units is just like the 2 lines at the top.
Okay.
And this is an insulin needle. This is only ever used for insulin. This is not used for any other sort of medication. And insulin is always given via the subcutaneous route, which is like just like in the fatty areas of your body. So to administer insulin, I'm going to show you on this so then you could teach back to me how you can do it too.
Okay. And would I be taking insulin in the morning before breakfast?
Yeah, so Humalog is a fast-acting insulin, so you would take it 15 minutes before a meal,
Okay.
because that's how quickly it works.
Okay, so 3 times a day.
Yeah.
Okay.
Or just whenever you need it. Sometimes your blood sugar will be low enough that doesn't require insulin. But right now, since your blood sugar is a little high, it's at 210, it should be like below 150. That's why you're getting 2 units of insulin
Okay.
right now. So the first thing you do is you take off the cap of the needle, like that.
Mhm.
Always point it away from you so you don't accidentally stick yourself. And then you pull back 2 units this way. Inject it into the medication vial like this, and then push it down, and then draw up 2 units. So you just draw it up like that. I always draw up a little bit more just so you could see what you're doing, and then push it out. That. And always make sure there's no air bubbles. Yeah, so that's 2 units right there.
Okay.
And then you would disinfect the area with an alcohol swab, and then you always pinch the skin to make sure you get like a good grip, and then you could either inject at a 90-degree angle or a 45-degree angle. But since we're doing the injections into your abdomen, you're always going to be going at like a 90-degree angle because there's more surface area.
Okay.
So you just stick it in like that, and then inject it and pull it out, and that's it.
Okay. And how would I just get rid of the needles?
So to get rid of the needles, you just pull the safety like that, and then throw it away.
Okay, so I guess, since the safety's on, I'm just gonna do like a verbalization of what you taught me.
Okay.
That way, like, you can correct anything.
Okay.
So to check my actual glucose level, I would sanitize the area first
Yes.
with like an alcohol pad.
Mm-hmm.
Then I would take the needle thing,
Yes. Prick.
and then wipe away the first blood.
Yeah.
Get the machine with the strip, have the strip absorb the blood while it's like calculating, absorb the first blood.
Mm-hmm.
And then depending on the numbers, depending on how much units I get.
Yeah.
So since I have 210, I get 2 units.
Yes.
Um,
And that is based off of the sliding scale for your insulin, and that was determined by your doctor, and I have a handout for you to see what the sliding scale is.
Okay, now can you hold that?
Sure, no problem.
Thank you. So to actually inject my insulin, I take the insulin needle with the orange cap, which is only for insulin.
Yeah, it's only for insulin.
Again, since the safety's on, I'm just gonna verbalize it.
Mhm.
I pull back 2 units of air, and then push the 2 units into this vial,
Mm-hmm.
and then I draw up 2
Yeah.
units. After I draw it up, I would sanitize the area with alcohol,
Mm-hmm.
and then inject at a 90-degree
Yeah.
with pinching it,
Yes.
inject, then cap the
Cap
needle,
the needle.
and then discard it in either my own sharp spin and
Yeah, we could get you a sharp spin.
Okay. Is there anything else I need to know?
Do you have any questions for me about this?
No, I think I have everything.
Actually, I have a question.
Yeah.
Is it only the abdomen that you're supposed to inject in, or?
Yeah, so with diabetic patients, insulin absorbs differently from the abdomen versus other like subcutaneous areas like the back of the arm or something like that. So since you're prescribed to administer insulin in your abdomen, just rotate sites within the abdomen. Like don't rotate sites to your arm or other areas of your body without your doctor's permission.
Okay.